Hello guys, welcome to Dr. Science. So today our topic is regarding the polyps, and in this video I'll talk about what are the two different types of polyps, how the diagnosis is made, and what is the treatment for these patients. So let's talk what is meant by a polyp. The definition of a polyp is nothing but a prolapsed pedunculated mucosa of sinuses. What is the definition of polyp? It is a prolapsed pedunculated mucosa of sinuses. Now what is meant by this? So usually we are having sinuses, right? Sinuses are nothing but your air-filled hollow cavities. So these sinuses are usually lined by a layer called as your mucosa. This is the mucosa of the sinuses. Now what happens in this patient is there is chronic infection or chronic allergy, due to which the patients will be having increased inflammation, which will lead to increased edema formation. Once again, patients who are having chronic infection or allergy will be having inflammation, which will lead to edema formation. So what this edema will do in this patient? Suppose this is the sinus wall or the wall of the sinus. There is a lots of edema formed in these patients, right? Now this edema is boggy with a lots of weight inside it. Now this boggy edema is going to push the mucosa away from its wall. So the boggy edema is going to push the mucosa of the sinuses away from its wall. Now this is a prolapsed mucosa. We call this a prolapsed mucosa of the sinus. Okay. Now once again I will draw this diagram here. So this is the sinus wall, and due to edema the mucosa is little bit prolapsed. Okay, this is the prolapsed mucosa. Now can you see there is a stalk? For this prolapsed mucosa there is a stalk present, or simply we can call this as the peduncle. Okay, it is similarly like a flower. Usually the flowers have a stalk, right? This stalk is called as your peduncle. So this entire thing here is called as your polyp. Now we can apply the definition here. Polyp is nothing but a prolapsed mucosa or the prolapsed pedunculated form of mucosa of sinuses. What is a polyp? It is prolapsed pedunculated mucosa of sinuses. So that is the definition of a polyp. Okay. Now what are the two different types of polyps? One is your antrochoanal polyp. The other one is your ethmoidal polyp. The ethmoidal polyp is also called as your nasal polyp because it is prolapsing through your nose. Okay, it can be seen through your nose or the nasal nares. Okay, whereas in the case of antrochoanal polyp, it is also called as your Killian's polyp. Okay, first of all I would start with the antrochoanal polyp. Now if you are following my videos, in my previous video I said that antrum is nothing but your maxillary sinus and choana is nothing but your posterior opening of nasal cavity. Don't worry, I will draw the diagram so you can understand. So imagine this is the face of the patient, this is the nose, these are the lips of the patient, okay, this is the eyeball. Maxillary sinus is a sinus which is present below your cheeks. So this is the maxillary sinus. Now imagine a person who is having infection in the maxillary sinus. Obviously due to infection there will be edema, and this edema or this boggy edema will lead to the formation of a polyp. This is the polyp here, which is coming from your maxillary sinus. This polyp is going through a opening. This opening is your posterior opening of nasal cavity, which is called as your choana. Okay, so the name makes sense. Antrochoanal polyp. Antro means maxillary sinus, antrochoanal, choana means posterior opening, and the polyp, antrochoanal polyp. It makes sense. Okay, now how the diagnosis is made in this patient? How the diagnosis is made in this patient? It is through posterior rhinoscopy. Now what is this posterior rhinoscopy? So usually we have an equipment with a mirror. So this is a mirror, and to this mirror there is a angulated stalk. Let me draw this. There is a angulated stalk. Now this is called a rhinoscopy mirror. Okay, this is called a rhinoscopy mirror. I hope everyone is similar with these terms. Now what we will do is we take this posterior rhinoscopy mirror. We take this posterior rhinoscopy mirror and we will pass through this oral cavity. We are passing this posterior rhinoscopy mirror through the oral cavity and we will place it near the opening. As you can see, we are placing this mirror below the opening. Now if we are placing the mirror below the opening, the polyp which is extending to the opening can be seen in this mirror. This is called as your posterior rhinoscopy. Okay, hope everyone understood this concept. Now some of the important points regarding the antrochoanal polyp. The antrochoanal polyp is that it is commonly seen in children compared to adults. And not only that, it is mainly because of infection. The children, they will be eating random stuff, so obviously it is due to infection. And most of the time, suppose this is the patient, it is, since it is infectious etiology, it is unilateral in origin and there is a unilateral mass. Okay, it is unilateral and there will be a unilateral mass. I hope everyone is clear with this. Next we will talk about the ethmoidal polyp, which is also called as your nasal polyp. Okay, I forgot to tell the treatment here. The treatment for this is surgery called as your functional endoscopic sinus surgery, or FESS. In antrochoanal polyp, we usually prefer FES, which is called as your functional endoscopic sinus surgery. Okay. Let's talk about the ethmoidal polyp, which is also called as your nasal polyp. Okay, suppose this is the orbit of the patient. These are the two orbits of the patient, and in between the two orbits is your ethmoidal sinus, and below is your nose. So imagine a patient who is having ethmoid infection of the ethmoid sinus. Obviously, if there is infection of the ethmoid sinus, there will be edema formation, and due to which there will be a polyp formation which will be entering your nose. Hence, ethmoidal polyp are also called as your nasal polyp. Okay. Now, what are the differences between the ethmoidal polyp and the nasal polyp? We have to see. But first of all, let's talk about ethmoidal polyp. It is commonly seen in adults compared to children, whereas in the case of antrochoanal polyp, it is commonly seen in children compared to adults. The second thing is it is due to allergy. As adults are exposed to pollution, obviously this will lead to allergy, and due to which edema will form. So it is a systemic condition like allergy. Whereas antrochoanal polyp, it is due to infection. Children will be putting random things in their mouth, and due to this there will be infection. I hope you understand the concept there. And not only that, in ethmoidal polyp, usually this ethmoidal polyp, since it is an allergy, it is involving bilaterally. Okay, allergy is a systemic thing, so obviously it will be bilateral. It is bilateral and multiple polyps. So suppose this is the face of the patient. Usually the polyps are bilateral and multiple. Okay, in case of ethmoidal polyp. Whereas in the case of antrochoanal polyp, these are unilateral. Since it is an infection, obviously it will be involving unilateral, and there will be a single mass. Okay, in infectious etiology, it is unilateral and it is single mass. Okay, I hope you understand the differences between ethmoidal polyp and antrochoanal polyp. Can you remember what is the treatment given in antrochoanal polyp? It is FES surgery, functional endoscopic sinus surgery. Whereas in case of ethmoidal polyp is due to allergy. So we usually prefer the treatment here are nothing but your topical corticosteroids. Okay, since it is of allergy, we usually prefer the topical corticosteroids. Now, before ending this chapter, I would like to show this small table. So here are the differences. As you can see, in antrochoanal polyp, it is commonly seen in children. It is due to infection, and they are solitary and unilateral. Whereas in the case of ethmoidal polyp, it is due to adults. It is seen in adults. It is due to allergy, and usually there are multiple polyps involving bilaterally, right? And as you can see here, the polyps may go anteriorly and present in the nasal area or the nares. And here one of the important thing is that some of the antrochoanal polyp may protrude through the corner and fill the nasopharynx, obstructing both sides. Okay, usually we do polypectomy or the first surgery, functional endoscopy, a functional endoscopic sinus surgery in antrochoanal polyp, and ethmoidal we usually do topical corticosteroids. Okay, and here you can see a polyp, antrochoanal polyp, which is projecting in a 14-year-old patient. So that was about polyps. Thank you guys.